Good morning, everyone, and thank you for joining us here for a Walter Tower update. Certainly, we appreciate the time you're taking because in 88 days, we will be moving into the new building, which we are about to share details with you. And I'm actually joined by my colleagues, Cathy Williamson and Brenda Campbell, both vice presidents that will also give you some detail. I'm here to perhaps introduce the overall reasoning and behind the Walter Tower and what you can expect. As some of you may know, we have a vision for the DeBakey Heart and Vascular, and that vision is that we aspire to be a nationally recognized leader in the delivery of quality cardiovascular care with a commitment to research, teaching, and innovation. And yet, when you hear that, one of the things that we also wanted to talk about was the concept behind it. How do you effectively manage it across the system? How do you actually make sure that we work in collaboration with each other and not necessarily have that competition among a system? So in order to achieve that vision about being a nationally recognized leader, that concept that we're also highlighting in gray is that we will be a clinical academic network for all cardiovascular physicians across the Houston Methodist system. In order to achieve that vision, this is our strategic overview. We talk about being a leader in cardiovascular care. We talk about developing and maintaining distinctive clinical programs, improving access to cardiology, both in the clinics as well as in the hospital setting, strengthen and grow physician network, because this is something that we want to be able to successfully do. How do we get physicians and various advanced practice providers interested in our organization? Walter Tower is a way to actually do that. It is a state-of-the-art building. And then perhaps in order to effectively manage these strategies, we have to create a new governance model. And I'm pleased to report that the executive committee did pass membership criteria for the DeBakey Heart and Vascular Center, which we will share with you all at a different meeting. When we talk about distinctive clinical programs, we were able to effectively divide it into three buckets. And as you can see the three buckets in front of you, there's programs that drive strategic growth: heart failure, transplant, valve structural heart, electrophysiology, aortic disease, adult congenital heart, and peripheral vascular. These are our programs. These are the programs that will drive innovation and growth into our campus, as well as drive innovation and growth across the system. This is what we currently focus on. This is what Walter Tower will support. What we also recognize is how do we actually have those other programs that make us a complete program, talking about advanced imaging, cardiac rehab, prevention, and wellness. And then when you look on your far right-hand side, these are the dependent service lines: cardio-oncology, pulmonary hypertension, limb salvage, and wound care. In light of the previous slide, I just wanted to share some slides with you. This is perhaps our only financial slide or statistical slide that shows you growth. Our organization cannot truly grow and support cardiovascular services if we have a limited footprint. When you're looking at Cath Lab volume on the left-hand side, you can see from 2015 to 2017 a 17.4 change in growth, and then you can also see CV imaging, a 13.2% change in growth. In order for us to effectively grow our program, we need more space. That's been demanded of us as an administrative group for a number of years. And for those of you that have been here some time, the Fondren Brown building has existed and has been in practice since 1968. It's over 50 years. So when you're thinking about Walter Tower, I know many of you are saying it's about time we opened up a new building in order to support cardiovascular services. The one statistic that we didn't have, but I do know it off the top of my head, in 2015, the Fondren Brown surgical volume was 4,366 procedures. This year, we're projected to do 4,800 procedures. So you're seeing an almost 400 case increase. When you're looking at an average of 3 hours per case, you need more ORs to effectively manage that 400 cases. Otherwise, many of you are just going to be in the OR 24 hours a day, and that's not something either you want or something we want, because we want you to be able to effectively manage your patients' needs. And I know very few patients that would be comfortable being operated on at 11 p.m. So I'm going to welcome you to the Walter Tower. Many of you have seen this building when you walk through the Research Institute entrance. This building represents 22 stories of state-of-the-art technology, state-of-the-art rooms, as well as a lot of new technology that has yet to be installed there. Brenda and Cathy will go over those details. This is a different view of the Walter Tower, and just for trivia, that circular structure at the top of the building, that's not the helipad. The helipad is behind that. That circular structure actually houses the elevator constructs and mechanical components. So I keep getting asked that in different buildings. And I said, please don't land a helicopter on there. All right. These are the statistics for the Walter Tower. As you can see, it's almost 1 million square feet. It represents 366 beds, 14 cath labs, and 18 ORs. Our current campus is about 3.5 million square feet. So when you're adding 925,000 square feet, we're now at almost 4.5 million square feet. I can tell you it is about a quarter mile from the main building on the first floor to OPC 26. I can only imagine how a lot of you will be walking in and out of this building back and forth from Smith to Scurlock. The advantage of this building, cardiovascular services is contained in this building along with some transplant patients that are purposely put into the Dunn building. So then that way it's ease of care, ease of transitions for patients, as well as trying to make the most use of your time so you're not walking back and forth unnecessarily. And I know while I talk about 4.5 million square feet, it's actually a very short walk once that building is open. I want to share with you some existing data. In our current footprint, we have 29 operating rooms. There's 19 in the Dunn OR and then 10 in the Fondren OR. For those of you that had the pleasure of working in OR 20 in Dunn, we don't have a number 13. Superstitious nature of our organization says no OR 13. That's why we have 19. And then you can see in Walter Tower, we had a growth of 8 ORs. We went from 29 to 37. Cath Lab, we're going from 10 to 14 Cath Labs, which is managing the increase in the demand of our cardiovascular services for the Cath Lab. Just want to go over a number of pictures in the next several slides because it will give you an illustration of what you can expect with the Walter Tower. This is our brand new entrance for Walter Tower. I do know that the fence comes down roughly May 1st, and this is what you will see. I think one of our challenges when you see such a beautiful entrance, like when you're walking to a hotel, our patients will have a higher expectation of us as soon as they're walking in. So please keep that in mind. This is the new front entrance of Houston Methodist when this building is officially opened. When you walk in, this is the information desk that you will see. This is the concourse to the main campus, and what you currently see in our current footprint, a lot of the services on the first floor are just for patient waiting area, walking from one area to another. This is that area in the Walter Tower. You walk down this hallway and you get to this escalator. The escalator is where it starts going into patient care, and then we use the term crosswalk. We know that people aren't familiar with our campus when they go, I'm looking for the second floor, because all of our elevators say crosswalk. It doesn't say 2. This is food services. We'll have a new gift shop. We'll have grab and go, and then we will also have Einstein Bagels in the Walter Tower. I do know we're negotiating for them to open up at 5 a.m. because I know many of you in this room are here at 5 a.m. This is the Barbara and George H.W. Bush Atrium. This is what you will see on the second floor. This slide can be a little bit misleading because people go, it's a beautiful first floor. This is actually the second floor. And I'm pleased to at least report that Barbara Bush had a private tour of the atrium about 3 weeks ago, so she did get to see this wonderful new building named in honor of Barbara and President George H.W. Bush. This is an illustration of the third floor surgical waiting room. This is where we start talking about staff experiences. On the left-hand side is multiple conference rooms that will be located on the first floor of the building. You can see on the upper right-hand side a number of lounges. There's staff lounges, there's physician lounge, and I know that we're trying to make sure that we integrate our staff and our physician so then that way there's a lot more collaboration. I'm sure some of that will work out when we move into the new building. And then you can see on the bottom right-hand side collaboration area. This is some of the new working space on each of the individual units. This is perhaps one of the most important slides, at least for me. This is a move-in date schedule for the Walter Tower. July 16th is when the ORs move as well as CVICU. And so Fondren Brown OR on July 16th will cease to exist and will be now named Walter Tower OR. And then on July 23rd, another firm date is when the Cath Lab and CCU move into that building. So I'm going to turn it over to my colleague, Cathy Williamson, where she'll talk about the details of the OR, and then that's an area all of you are interested in.
Thank you, Michael. Good morning. I'm going to go into further detail of the operating room areas and the transition. As Mike already showed this slide, we are getting an increase of operating rooms. Currently, the Fonda Brown OR can utilize up to 10 open rooms, and they use 2 hybrid rooms out of the Dunn OR area. With the new setup, they'll have 11 open ORs. Also, they'll have 3 brand new hybrid rooms. And then in there are 2 intraoperative MRIs, which will be ran by the neuro services. So that's why the numbers, you may be wondering why it's 18, but we only have access to 14 at the beginning. Plus, we'll have 2 shelled rooms, and that will allow us for growth in the future. I want to show this one to see the layout, and I'm going to use the pointer here. This part is the OR area, which includes the IMRI. This area here, you may notice, is the current Fonda Brown OR. It's eventually going to be a new state-of-the-art pre-op and PACU. It's going to be gorgeous. The PACU is going to be divided into 4 areas instead of one large one to cut down our noise and help with privacy for our patients. And then we'll have all private rooms in the pre-op area. But because it's currently the Fonda Brown OR, it's going to take between 18 to 22 months in order to go through these phases and have access to that. So I want to go into that in a little bit more detail on some slides to show you how we're going to transition. So the green highlighted area is the portion that's the current Fonda Brown OR. That's going to be our first phase 1 that will go into construction probably within 2 weeks after we move the OR into the new Walter Tower. At that time, we'll be using the current pre-op and PACU that we already use, and then we'll also use the current CVICU or Fonda 3 as overflow for PACU because we will not have enough space. With that, there's going to be some restricted areas for patient flow, and we're working on now where the families will wait. We'll have different waiting areas. We'll have a waiting area here for when the patients show up for surgery, and then we'll transition their families over to the new waiting area until their patients are finished and they get to go upstairs to either the ICU or the floor. For phase 2, then we'll have access to part of the new pre-op and PACU, but then we have to close down the current pre-op and PACU, which is in green, and that portion will go down. It won't take as long, but we'll have that down probably for at least 6 to 9 months. Then you'll see on the yellow access points, we'll have some more walking areas for patients and families to go through. And then eventually, it's all going to be perfect. And we're going to have a beautiful pre-op PACU, CBOR. That pre-op and PACU will also service the Dunn OR. Our ambition is to be able to close down Main 3 Northwest, depending on our volume. Just a little bit to show you about elevators, because I know a lot of people have been asking, where do we go? These are the red ones are where we'll transport patients and staff, and then the yellow ones are our family. And then the staff are allowed to use those as well, kind of like we use OPC for transport for people going places, just not patient transport. And then a lot of people have asked, okay, since the CVICUs are on a different floor than the OR, how's this going to work on transport? Because now it's very easy. We just go down the hall. And we have a lot of equipment that goes with our patients as we transport them. Well, as you can see up here, this is the size difference. This is the size of the current Dunn elevators, which is about 5'8", and the new elevators are 8'4", which is lots of space that you'll be able to fit a full-size bed, equipment, and all the staff that you need to in order to transport them up to the next level. And even though it seems like we're going from the 3rd floor to the 9th floor of the CVICU, there is only one stop in there, which is the Cath Lab. The rest is mechanical. So it is a very quick flight, per se, and also we'll have an elevator key to help expedite it so that we don't have to wait on elevators. I'm going to just show you some pictures so you can see the inside. And as you can tell in these pictures, there is still some construction going on, so I apologize for some of this. This is your hybrid room, and it's still wrapped up for you. Hopefully by now some of that has come down. but very large, spacious rooms to be able to handle the types of cases that we're doing. One of the biggest things with our hybrid suites, though I know the staff is excited about, is the storage space. So we're not having to run in and out of the operating rooms to get what you need. This is a picture of one of our open ORs, which are also spacious. You'll notice all of the booms that we have so that we can get the equipment off of carts and get things off the ground and be able to, and not have so many cords around. It's very state of the art and lots of monitors and such too. Here's also the open OR, plenty of storage for those of you that work in the CVOR now. The Fondren OR, you'll know there are not a lot of areas for storage and places to put things, and staff have to run in and out a lot. This is going to help with that, keep your staff in the room. And then this is one of the best parts that I know the staff are excited about. This is a core, which we currently do not have. So the core, you'll house all of your equipment, your instruments and your supplies, and all of the open ORs will have access to this core to be able to run in and out and not have to call SPD for instruments or call central supply and such. We'll have plenty of room. And speaking of central supply, currently there's a very small area below the Fondren Brown OR that services it, and we have to use the elevators to go up and down to bring up the instrumentation. This is going to be on the second floor below, but it's going to be very expansive, and they're going to be able to handle a lot more volume of equipment and instrumentation. Now I'm going to pass it off to Brenda to tell you about the Cath Lab and the floors.
Thank you, Kathy. Welcome, everybody. I'm going to walk you through our Cath Labs as well as our inpatient care units. So you will see that quite a bit of Walter Tower is actually dedicated to DeBakey Heart and Vascular. So have you seen this slide before, as in Michael's presentation? We are actually moving from a 50-year-old building in which we currently run 10 Cath Labs. They are split between level 4 of the Fondren Brown as well as level 10, where we have 8 of those Cath Labs. So in Walter Tower, we'll actually have 14 Cath Labs, but as we move over, we will actually transition to get ourselves up to 14. Our first phase, although it's a little bit difficult to say in here, we're going to have a total of 14, but in our first phase, we're actually going to go over with 7. And the reason why we're doing that is because we have to take existing Cath Labs and move over into the area. So beginning in about the end of May, you will start to see some reduction in actually room size in our current Cath Lab setting. We're working with our medical director, Dr. Kleiman, as well as the director of the area, to make sure that we continue with that volume. But we will not actually be up until for 11 Cath Labs until about October of this year. So a big transition in the Cath Lab area. This is actually the Cath Lab layout. This is Walter Tower, 4th floor, and we do have some areas in here where we have future Cath Lab space. So we'll build out 11, as I said earlier. 2 of those will be Cath Lab space for future. And then I'm going to talk a little bit more about this MRI CT that's up there in that top portion, what that's going to be. So here is that MRI and that CT combination of a biplane. Please don't think that this is coming in anytime soon. It will be predicted sometime in the late 2019, maybe early 2020. But what you see there is on the right-hand side, you actually see where there is an MRI unit. Over on the left-hand side, you actually see where there's a CT and an angio room, and this will be a combined area. Right now, there is significant work going on in the Research Institute with this particular type of equipment, and so we'll be bringing that into a patient care area, as I said, late 2019, early 2020. Now, we'll take a little bit of a tour through the Cath Lab area. This is, again, on the 4th floor, so it's a completely integrated space. Today, we actually run some of our Cath Labs on the 10th floor, and we actually have our pre and our post Cath Lab area on Fondren 8. So today, we're actually in 2 different floors. This, the Walter Tower allows us to be completely on the 4th floor. Better experience for our staff, our physicians, as well as our patients, as they all remain in that one area. So this is the spacious Cath Lab nursing station, as you can see as we come in. Touring through, this is one of the Cath Lab rooms, large, spacious area. You can see here where, as Kathy pointed out earlier, plenty of places for supplies. And you can see that the equipment and the booms and how the equipment comes off, and the lack of what we call a lot of cords and a lot of wires running across. Very clean environment here. This is our single plane, so we're going to have single and biplanes in the area. This is a single plane. It's starting to see a little bit more. It gets a little bit more crowded. I should say I use that word very loosely because these are huge rooms. And although we're showing you pictures, you really just do not get the feel of how big the space is that we're moving into in the Walter Tower. It doesn't matter if we're talking about OR rooms, Cath Lab rooms, or patient care rooms. Everything is bigger in the Walter Tower. Here is a Cath Lab single plane room. Again, you can see where the equipment is. A lot of hanging from the booms, very clean, a lot of space to move around the equipment and move around the room. This is a biplane room. You can see the biplane in there once again. Equipment very similar in the layout of the rooms, sizes of the rooms, just a little bit different equipment in there. And again, as we've said within the OR, as Kathy pointed out, we've really tried to increase the supply storage in the rooms. Keep the patients, or keep the equipment, keep the staff, make it very easy, make it very comfortable, supplies readily available, helping to make sure that we provide smooth patient quality care. Here's our Cath Lab control room. I don't know how many of you have actually been up into our Cath Labs, but our control rooms are very, very congested and tight, and these control rooms allow for more counter space and much more computer equipment. Moving through the Cath Lab corridor, you can see down there on the left-hand side are the rooms, and then down further be more rooms, so opens up very nicely. Plenty of space as we come through that corridor. And then, as we pointed out earlier, again, our supply rooms are very big, spacious, will be laid out easily for the staff to easily find the supplies and have a lot of inventory on. Cath Lab Biomed, if anybody's in here from Biomed, again, a nice spacious work area for them to keep equipment in, keep it well maintained and readily available for our patients. Conference room, this will have windows in this conference room. It's not quite done yet, as you can see. Will of course be a conference room table. You see the large screen TVs in there, very easily placed within the environment for quick meetings and labs and whatever else kind of information needs to be shared in that room. Moving now to the Cath Lab Physician Lounge. This is a very spacious area. You can see out the windows. You can see if you can, the McGovern building over there, the nice waterfall, and again, as a reminder, we're on the 4th floor, so there is a nice view out into the Texas Medical Center. Taken now into what we call our Cath Lab AOD, or Admissions, Observation, and Discharge area. This is where our patients actually come in today in Fondren 8. So this is the new place that they will come in again, is on the 4th floor. So this is the area they came into. We'll check in and actually be discharged later, and I'll have a few more slides to show us on this. This is the staff shower area. Again, we want to make sure that everything is nicely put together for our staff to support our staff. We know that quality staff brings to quality patient care. Procedure rooms, we have 2 procedure rooms, TEEs, other types of moderate sedation in these areas, nicely conveniently located, spacious once again. We've talked a lot about elevators in the building. Kathy talked about elevators. I know that as we talk with our staff and we talk with our physicians, the size of the building, how many stories in the building, the movement of the patients from the Cath Lab to the OR to the ICUs continues to be a topic of discussion. And so what we've tried to do is lay out the elevators A, B, and C as we work through scenarios, walking with our staff, what's the right elevators. And this is elevator B. This is really the main elevator area in which we will plan to move patients between those various units. And although we don't have a picture of the size of the elevators, they are large. Very, very large, will accommodate beds and vents and multiple people in there. So this is that elevator bank. Moving now into the PACU, the area in where we recover patients after their procedures in the Cath Lab. You can see a very spacious area, open area. The nursing station is there on your left. The bays are on the right, so easy to see the patients and recover and, safely. Here is what we call an AOD room. Now, today, our patients that are observation, post-procedure, and need to spend some additional time with us, they today go up into an inpatient unit, mainly Dunn-10 West, and spend the night and basically are in an inpatient environment. That means that they're moved a couple of times. What we plan to do when Walter Tower opens is actually keep that patient population with us in the cath lab, with the nurses, with the physicians, and then we will discharge them home. One of the reasons we don't do that today on Fondren 8 is because of the lack of restrooms. So you can see on the right here, we've highlighted that there is a private room with a restroom facility, so that does accommodate an overnight stay or a longer stay of the patient within our environment as they're recovering from their procedures. And there's just another shot of how large the restrooms are. This is the staff lounge, and as you recall, Michael showed you the atrium. We're on the 4th floor. There's the large mosaic that looks back. So once again, the staff have open windows, maybe not to the outside, so to say, like our physician lounge, but open windows and a nice, relaxing environment. Consultation room, if we want to bring a patient's families in, have a chance to visit with them, explain the procedures more, a very nice room to be able to do that in. And then as we move into the waiting room, if any of you have been up to Fondren 10 today, our waiting area is substandard. There's not enough waiting chairs in there. It's very crowded. It's just not a comfortable place. This will be our new cath lab waiting area. It is 60 plus seats. And as we move through some of these slides, you'll be able to get a little bit better feel of how big it is. That's the coffee area, refreshment area you see in the very back. Those are windows to the outside on the right. And then on the left, again, it looks down into the large atrium. Another view of where we are here. Again, nice view of the Texas Medical Center out to the right. This is the mosaic off to our left. So again, a lot of light. Even more light. We put light into the ceiling to bring in more light into this area. Now I'm going to transition into our inpatient units. As we said, the CVICU, the CCU, and then 2 of our inpatient, what we refer to as DUN 9 East and West, will all be relocating over into the Walter Tower. We will do that in phases, as Michael showed earlier. Our first move will be with the CVICU, and that will be July 15th, which is actually a Sunday. We will move. What we call first patient day is actually that following Monday of the 16th. So just to kind of get a little bit of a feel today of our capacities and where our units are and where eventually our units will go. Not all of the inpatient units that support DeBakey Heart and Vascular will move over into the Walter Tower. We currently have one unit, Fondren 11, which was referred to as our heart failure unit, that will not move over into the Walter Tower, but will move into an expanded space, and that's DUN 9. So on the left-hand side, you can see our various units. Our CCU, or our critical care unit on Fondren 10, has 18 beds. That will actually be going over to Walter Tower 9, the 9th floor, and eventually that floor has a capacity of 30. Our plan today is open up to 24 beds on that floor. The cardiovascular ICU today is on the 3rd floor of Fondren, 40 beds in our volume and our capacity today. Walter Tower 10 will be the new home, and that, as you can see, is a reduction of 4 beds. So somebody may say, that doesn't make sense. That's a reduction. We've been looking at this. We do have additional beds, as we've said, on the 9th floor to be able to accommodate critical care space. DUN 9 East and West today houses the majority of our post-CV patients, some of our pre-patients that go into surgery. You can see there a total capacity of 60 between the east and the west side. They will be going into Walter 19 and Walter 20 much later in the year, and they will be going up by 12 additional beds there for that entire service. Fondren 11, as I pointed out today, is on the 11th floor of our building. They have a capacity of 34. They will be moving to DUN 9 East and West. Although that floor has a capacity of 60, our plans right now are to open it up with 50, so that gains us some additional heart failure beds. DUN 10 West today is where we take post-cath as well as cardiology patients. DUN 10 will be closing eventually. Those patients will be moved into different parts of DeBakey. 15 of those patient rooms will actually be taken down into our post-cath area that we were talking about, overnight stays. And the other 15 will actually, the 12 of them, so we lose 3 there, will actually be going up into Walter Tower 19 and 20 into what we know today as DUN 10, or DUN 9, I'm sorry. And then as we look down there at the totals, you can see the total today is 182. When we move into the building, we'll have a capacity of 209 with an additional 6 that will bring us up to 215. So growth there. Here's what we look at. We call the Walter Tower a little bit like a boomerang type of a shape there. This gives you our typical ICU plan. Now, all the floors in Walter, with the exception of floor 9 and floor 21, have 36 beds on them. The 9th floor, which is where you recall CCU will be moving to, that will house the new pharmacy satellite. So that reduces that floor by 6 beds. And then on our top floor, our VIP floor, the lock pavilion, we'll have a total of 24 beds up there in a VIP space. As we move through here, here's our typical acute care floor plans as you see. One more change that I did leave out is level 15, which will be our oncology services. This will house our BMT coming over from the main unit, and of course there's additional resources there, so that floor will be a little bit limited. Again, not part of the DeBakey Heart and Vascular. This is the VIP, or the locked pavilion, as we've said and pointed out earlier, in its layout, a little bit different room configuration to support that patient population. Here's what we're really proud of. These are the rooms. On the left-hand side is what we call our typical acute care or med-surg room, and on the right side is what we would call our ICU room. I want to point out there down on the very bottom, our rooms today in Dunn, just to give you a perspective here, about 196 square feet and about 40 more for the restroom. In the new Walter Tower, that room will now be 300 square feet. Lot bigger in size. And in the ICU room, it's actually going to be even a little bit bigger, 320 square feet. What you see there in the left-hand side is where we've tried to design these rooms. So the front part, as you come in towards that patient, we really want that to be the primary caregiver. The first entry in, see the patient. Then you have the patient zone, typically is the bed, of course. And then we have a secondary care zone as you move around that bed. And to create a family zone, we wanted to move the family, of course, towards the back end of the room. That is where the windows are, and again, allows the care team to come in and out and care for those patients, and allows an environment for the family to be in the room as much as what they possibly can or would like to be. The ICU is very similar in that, and you'll see the primary zone, the patient zone, secondary, and again, we will encourage families, limited numbers of families, to be with our patients. Here, moving into what we call the state-of-the-art and more of what the layout of the floors are. Each one of these floors, again, has 36 beds with the exception of a few that I talked about. And along this unit, because these floors are very large, there will actually be like 3 different, for lack of better terminology, nursing units. Around each one of those nursing units, then, are 12 beds. We do want to encourage our caregivers, and I have a picture in a little bit that shows a charting alcove. Get them out into the corridors, close to the patient rooms, and not have so much congestion and activity going on in the traditional nursing care units. And so as we walk through here, we'll see that a little bit more. This is actually a critical care corridor. The acute care corridors will look very similar. We just won't have those, what we call those breakaway or those glass sliding doors. There's charting alcoves that we can see over here on the right-hand side with the small window, and there's other pictures that actually highlight this a little better. This is a typical critical care room. You can see the booms in the background, which will hold the equipment, cleans it up nicely, doesn't restrict us to a head wall as we do now, allows for easy access around that patient, the head of the bed. And then in the top there, for you, those of you that like to do procedures or need to do procedures within our ICU rooms, those are procedural type of lights, very much brighter than what we have in our facility today. You'll see the glass door there to the right, and then all the way in the back, that's that family patient zone, or the family zone where we will encourage visitors. And I know there's no chairs in there today, but we will have chairs, sofas for the families to be able to sit comfortably. This is what our acute care patient room looks like, very similar, not the booms, of course, a little bit more, kind of a more environment that's not quite so sterile. Again, large windows in the back. You can see there more of that family area, that seating area. And over to the right, very difficult to see in this photo, Instead of swinging doors for our restrooms, we actually have sliding or like barn doors. I know it's kind of odd to say a barn door in a hospital setting, but the swinging door actually takes up a lot of space, and it seems like if those of us that are caregivers, it seems like you're either opening the door right into the patient all the time and challenged with trying to ambulate in their equipment and getting him to the restroom. So much cleaner look with that sliding door. It actually opens up more square footage as well. Another thing that we have are what we call pass-through model. This is where out in the hallway, you can see it on the left-hand side, we can actually open up a medication cabinet there. It has a lock, can be used for medications or supplies. And then inside of the room on the right-hand side, another lock device allows the caregiver to have access to it. So this allows the supplies pharmacy to be delivered in the hallway, not needing to come into the room necessarily, while the caregiver has total access to that in the room. And vice versa, you can pass supplies from the room out into the hallway there. Again, restrooms are large and spacious in the Walter Tower for our patients. This is that charting alcove that I was referring to. This will have 2 workstations set up. You can see the windows there on the right and in front. Those allow viewing into the patient room, so easy access to be able to view patients while you're charting in the alcove area. And then one thing I want to note up above, there's a large flat screen. This is where we'll actually have the patient's alarms and monitor rhythms brought out into the hallway, and so there'll be direct visualization of what's going on in the rooms, in the hallway for our caregivers to easily identify what the rhythms are, as well as any alarms or any alerts that need to be coming through there. With that then, I close up this part of the presentation, and I would encourage that if there's any questions, we have Michael, Kathy, and myself. We'd be glad to answer any questions or address any concerns there may be. Thank you.
Let me try and do this. Let me make one clarification. So that state-of-the-art room that Brenda talked about on the 4th floor, where it has a MRI, a CT, as well as a biplane, that is being run as an operating room. It is up to operating room standard and is a collaboration between the cardiovascular surgery department and neurosurgery. We are working on some of those details, but I did want to make sure that we were aware it is an operating room and not a cath lab. I do know that there's a great deal of interest in that room. We continue to work with the chairmen of those departments, and we'll work the details with them out, and we'll share it with you. The other thing that I also want to at least make sure all of you are aware, June 28th, we have an open house for this building on June 28th. I believe 2 p.m. that afternoon. It's open up to everyone on this campus, but particularly for physicians because of particular needs that you may have or things that you may want to see. 6 a.m. to 10 a.m., there's an open house for physicians. The rest of the day is for everyone that wants to visit that building. So let me also talk about all the details that you've seen shows what it looks like when you move into the building. We are talking about day-to-day operations and what you can expect. A lot of the detailed plans that Kathy, Brenda, myself, and many other leaders that you are not going to see is that transition between July 15th to July 16th. What will happen is many of you will walk away on a Friday and hopefully have a very nice weekend on July 12th. But when you walk in on July 16th, or excuse me, July 13th, when you walk in on July 16th, you're going to be in a brand new operating room. You're going to be a brand new CVICU, and that's going to be a dramatic change. There's a lot of scenario training, scavenger hunts, staff orientation that will occur, and we call a lot of the magic will occur on July 15th because that's when the patients will transition from one unit to another. That's when the ORs will transition, and then the following weekend, the cath lab and the CCU will transition. The other thing that I want to mention is for any changes that you wish to see in the new building, if there's something that really annoys you right now in your current footprint, please talk to the respective manager of the unit, the director of the unit, talk to the medical directors and say, hey, I want to see this in the department. We can at least account for that in our planning. Because when we go into that building, it's like moving into a new house. If you have an issue or a complaint barring true safety patient issue, we will put it on the list. We cannot change every single thing based upon physicians or staff coming to us and saying, I don't like this, I don't like that. Otherwise, we would just be doing constant changes. So with that, we're happy to answer any questions that you may have about the Walter Tower. And thank you again for joining us.
My question is, with all the transitions, with every unit moving in, and then the back end things that are going to be done in the Fondren space, when will everything be done? What is that projected date?
So I will give you a very simple answer, and my colleagues might perhaps give you a more detailed one. This year is predominantly focused on moving into the Walter Tower safely. 2019 is just backfilling the spaces that are emptied out by those units that Brenda described, because we're not going to move Dunn 9 into Walter Tower and then just move a unit into Dunn 9. There's behind-the-scenes plans on how to renovate the head wall, whether or not we should actually put barn doors in Dunn 9 to actually alleviate those issues when you're transferring patients from a stretcher to a bed. And then we're also looking at the needs of the patient and the family. So that's 2018, 2019, and I know based upon what Kathy has also presented, it may take you into 2020. Okay. Yes, ma'am. If I recall correctly, and Brenda can correct me if I'm wrong, there are ceiling lifts on every...
I don't know the exact count, but we did account for some in some of the rooms, so we may have to switch patients around if they need it. But most of the ICUs, I know the NICU will have it, and I believe some in the CVICU as well will have the overhead lifts for the patients.
Guys, that was absolutely spectacular. And believe it or not, this was a dream that was first raised in 2000 when the Heart Center was first being organized. It's wonderful to see it come to fruition. A question, parking, is there any additional parking areas, and how do people get into the building?
You know, I was hoping that question didn't come up. So we currently have 157 parking spots in that building. It is valet only. What we are trying to work out now on this campus, as well as with all the employees, is to actually not have employees park on this campus and park in the Smithlands, which we actually pay for parking for all of our employees to park there. What we are trying to manage between now and the middle, if not late 2019, we are planning to build an administrative building which will be adjacent to the Houston Methodist daycare facility. It's going to have 1,700 parking spots. So a lot of the individuals that work on this campus are not directly tied to patient care, but work and potentially park here will be moved to that building. So in that way, that creates more parking spaces for our patients. It's a work in progress, Dr. Reiser.
It's absolutely beautiful what you showed today. Thank you.
One comment I do want to make, and I'll reference Dr. Lumpson. He toured the building, and he told both myself and Roberta that as much as we talk about length of stay in a lot of these meetings, we now have a length of stay problem because no one's going to want to leave that building. So, other questions? I'm going to defer that to Kathy.
As of right now, there are no call rooms designated in the Walter Tower. We are keeping what we currently have in all the locations, and as we slowly move other units around, we will look at where we can get some of the call spaces, for example, that might be in a building further away, closer to the Walter Tower, if need be. But at the time, there are no call rooms.
Other questions? Between now and June, we encourage you to talk to the directors and managers. There's a lot of scenario training. We've accounted for, I would say, as much as we can possibly think of, and we want to be 100% ready to move into the building, but candidly, we can only account for perhaps 90% of things because things will go wrong, things will happen that we didn't expect. We want your feedback. Please tell us some of the problems you anticipate so we can address it. And then we will use that transition period to make sure that that building operates very, very smoothly. One of the things that we didn't illustrate because it is very confusing, we have 33 inpatient nursing units in this campus with the exception of the 5 additional ICUs. That represents so many units that when we started planning this building and then all the movement of the backfill, we are cohorting cardiac services both in the Walter Tower as well as some of the transplant patients in the Dunn building. So once again, we are looking at both the providers, the patients, and all the services that you need. One of the details that we may have not also shared with you, there's a CT on the first floor. There's also a MRI on the third floor, and then in the future, an MRI on the fourth floor. More to come on the Walter Tower, but I do know that's a state-of-the-art building. Our goal now is to make sure we move in safely, and then we welcome your feedback. Happy to take any last questions or concerns you may have. Okay, I'm told to wait 9 seconds after I ask that. It's been 9 seconds. Thank you very much, and I hope everyone has a very good day.